Charlie, do you mind on the English going to the first slide? Well, good morning once again. Welcome to today's session for Navigating Life in California for newly arrived Ukrainians. We'll give a couple moments here for people to continue to come into the room. As you're getting situated, take a look at the bottom of your Zoom controls. And if you would like to listen in Ukrainian or Russian, please select the globe icon and navigate to the language that you would prefer. We'll get started here in about 1 minute. Dima, if you wouldn't mind sharing that one more time, and then we'll get going.
Доброго дня. Ви можете вибрати мову, на якій слухати цей вебінар, користуючись кнопкою унизу Zoom на тулбарі Interpretation, Listen in Ukrainian. Добрый день, вы можете выбрать нужный язык, пользуясь кнопкой на тулбаре в Zoom внизу Interpretation, Listen in Russian.
Okay, well, good morning. Welcome to today's session on getting help in the first year. Go ahead and go to the next slide. Today's session is about learning what agencies can support you, both local and county organizations. This is a part of a series. Next slide. This is a part of our Navigating Life in California series, put on by Solvera Consulting in partnership with the California Department of Social Services, Refugee Programs Bureau. These happen on Mondays through August, and we start at about 10 o'clock. So the next session will be on stabilization employment or your first jobs here in the United States. Then June will be dedicated to learning about education, both primary education that we'll talk a little bit about today, as well as post-secondary or university and college education and beyond. Next slide. Some reminders for today's session. All participants are on mute. As we have mentioned, please select your preferred language. The question and answer box is live. So if you have questions, as they come up, please put them in the question and answer box because the chat box is disabled. So go ahead and put them in the Q&A box. You can upvote questions, which means you have the same question. And that lets us know that that question is really desired. Finally, at the end, there will be space for a survey, which your feedback really helps us grow and get better, as well as know what questions or topics you might like to see in the future. Next slide. Well, my name is Hannah Messick. I am a member of Solvera Consulting, and Solvera will be presenting the information today. I have my colleagues here with me, and that is Charlie and Carrie Ham. And we also will be hearing from Nova Ukraine. Nova Ukraine is a partner of Solvera Consulting's, and they're providing some of the interpretation and translation today, as well as great support, as you'll see in some of the additional resources we list at the end. Next slide. For the expectations, we're really talking about today what agencies and organizations can support you, how to enroll, who can enroll, and some tips for what you might need during that process. As you're asking questions or thinking about things today, please do not share any personally identifiable information, like your maybe certain numbers, your address, things like that. Keep it general, maybe list your county or something like that, so we can provide you resources in your area. We're not going to be covering topics like immigration statuses, re-parole, some of those topics today, but you can find that information on supportguide.org, as well as a list of our prior sessions. Next slide. Today's session is really pointed for and focused towards those who have Ukrainian humanitarian parolee status. So that is a particular status assigned that is recognized by the Office of Refugee Resettlement. That is a federal agency who helps fund programs at the state and county levels. So we're really talking today, it's called an ORR eligible population. For today, we're really talking to refugees, those who have asylee status, and in today's call, those with UHP status. Next slide. After today's session, you're going to be able to know where to go for which service, understand the differences between different types of agencies. All of these agencies we're going to talk about today are here to help you, but each one plays a unique role in what they're able to do, and maybe what their expertise is in. You're also going to be able to know why we recommend seeking services in a particular order, right? A particular sequence, and why that's important. Finally, a goal would be that you can advocate for yourself when you're in these situations. It can be nerve-wracking to tell somebody who's in a position of power that you think they might have made a mistake, and we'll talk you through how to do that. So today, next slide. We're going to be talking about an overview of agency types. We'll give you best practices and tips for how to engage with those various agencies. Again, like we talked about, that sequence of how to progress through, and then finally, where you can find additional resources. Next slide. So this has a lot of content on it. These are the main agency types that you will be interacting with in your first year. The top one at the top bar there you see is federal or public. Their job is at the highest level in the United States is to determine which programs to fund. So their job is to take funds from US taxpayer dollars and get those to the right place, right? Get those to states and local agencies. Then the states administer those funds. So that might be California Department of Social Services, Refugee Programs Bureau, and they administer those to the local levels. So you see the arrows here pointing on the slide, because these are the next ones are the agencies that you're going to be interacting with the most. The purple arrow has county services, so that might be Department of Human Assistance or Department of Social Services. Sometimes the name can be different depending on where you are in the state. Their main goal, their primary focus, is to help you enroll in public benefits. They are the agency that distributes those public benefits. They have a lot of other services, but that's their primary focus. Resettlement agencies, the next one on the list, their main job is to help individuals during the first 90 days. Now, a resettlement agency, as we'll talk about later, may also provide other services. Community-based organizations can do all sorts of things, and they mainly focus on things after the first 90 days. Finally, you see medical providers, employment services, and schools. I'm going to focus for a moment on those employment services. Their job is really to help you get a job, get a better job, and support you in maintaining that job. So let's go to the next slide. The public entities that you might be interacting with, some of their logos are here on the right. So you see some county logos, benefits Cal, right? That's where you can sign up online for public benefits. And the map you see on the left shows you where these agencies are located. We'll send you a link after today's session for you to access those agencies specifically, as well as how to find who's closest to you. Next slide. Those agencies can help you enroll in receiving public financial cash assistance. Sometimes that's called CalWorks. If you're an individual who does not have children, it might be called Refugee cash assistance. A major thing that they help you with is to find the right employment service provider. And we'll talk on another slide about those. Women and children, special monies and supports for mothers and those who have younger children. CalFresh, there's also a state version of that that's called by a different name, but really what that is, they'll help you identify which program can help you have money for fresh, healthy food. And finally, Medi-Cal. And they're there to help make sure that you have insurance for any of your health needs, and we'll talk about those. Next slide. So if you need to enroll, we'll send you the link. We'll also post it in the chat at some point today. But you'll go to this website and select Apply for Benefits. You'll see that there's also additional supports there on the website. It's also where you can manage your benefits. So it's where you can get updates on what's happening with your benefits. Next slide.
So this is Carrie, by the way. When we talk about resettlement agencies, it can be confusing because the entire process of living in a new place can be considered resettlement. But the term resettlement agency, or RA, is very specific and different from the many organizations that do resettlement work. The resettlement agencies, or RAs, are 10 agencies that work in the United States in the initial 90 days. And we have the logos of all 10 agencies here. California is the only state where all 10 agencies have offices. So it is very likely that one of these agencies is very close to where you are in California. But it's important to remember that these agencies do a specific program from the federal level of those initial 90 days of refugee resettlement.
I also want to highlight that these agencies are legitimate. They can help you. And in that, it's common for them to ask you very specific questions that may feel a bit invasive. They might ask about your relationship status, your finances, other what feels like very personal information. But these agencies, if they are a resettlement agency, are legitimate, they are official, and that the information that they might be asking for you is to complete specific forms and to ensure that you're eligible for services, because they are responsible to make sure that the right folks are getting the help from the federal government. Next slide.
So some of the things that the resettlement agencies do is they are responsible for helping refugees that are part of that federal program find initial housing. They also help connect to other services, such as enrollment in education. That can be K through 12 for children, or it can be adult education. They also help connect to services that assist with employment. Sometimes they actually have those services, and sometimes they are referring to others who have the services. But what a resettlement agency does is help connect to those services. They also are responsible for some of the initial financial resources that are part of a program. That can also mean providing basic services, such as that may be part of the program as well, such as initial goods that can come with enrollment in that federal resettlement program. Next slide. That is different from community-based organizations. These organizations exist to help newcomers, but they are not one of the federal 10 RAs, but they do many, many services that can help, and each organization offers different services. Sometimes it's connection, it could be workforce, but these are organizations that are created in the community to assist. There is another term called ethnic community-based organization, or ECBO. These are community-based organizations that are formed from one particular community. In this case, we have listed some logos of some ethnic community-based organizations that are from the Ukrainian community. Example is Nova Ukraine, House of Ukraine, Slavics.org, Ukrainian American House, Refugee and Immigrant Transitions. So while earlier we spoke about resettlement agencies, ECBOs may or may not, depending on their programs, receive public funding. They don't receive public funding, it means they are funded through donations. So they may or may not have formal accountability measures. As Hannah mentioned, the resettlement agencies all must, because of the program that they are in, have very formal accountability processes. This does not mean that a community-based organization does not, but it does mean that it's possible that they may or may not. They may or may not have eligibility criteria. Because it's not dependent on a particular program, such as the federal resettlement program, who is eligible to participate could be broad. Whereas with a program that comes from either the state or the county or the federal level, there may be very specific eligibility requirements that determine who can enroll or not. They may or they may not provide social services, whereas they can. Serving refugees does not necessarily mean they are a resettlement agency. While this is very confusing, because many resettlement agencies also provide many of these services. So it is something to understand that when you engage with an organization, what type are they and what type they're not. And we'll get to some of that later, but it is always okay to ask.
Mhm.
And then finally, an ECBO or a CBO may have trained and paid staff, but they may not. You may be engaging with an organization and the people are volunteers, which does not mean they are bad or good. It just means they are not paid and potentially trained to the same level. Next slide, please.
So when it comes to medical providers, there are a few things to remember. For immunizations or vaccines, those are required to enroll children in school. So expect to have that be a part of the school enrollment process. But specifically for Medi-Cal and when you're engaging with a medical professional, let's say a doctor, you can request a specific provider, so a specific kind of hospital group or provider when you apply, and you would talk about that with your DHA or Department of Social Services, right? So that county eligibility worker. When you're going for a medical appointment, you can request interpretation. It must be provided if you request it. Again, if you request interpretation at your medical appointment, they must provide it. It can take a couple weeks for interpretation to be scheduled, but it's really important that you fully understand your medical care and what is being discussed. Also, medical terminology can be really difficult, and it's important to have someone who's specifically trained in interpreting and translating medical terms. So we really want you to understand what's happening with your care. A reminder that in the US, your dental and your eye insurance is separate than the rest of your insurance. So make sure to request that or discuss that with your county caseworker as well. And then remember that mental health services are also available. Next slide. So it can be difficult to determine where you should go if you're sick or injured. So from the left of the screen to the right, we're going to talk through primary care. You may hear some people refer to that as PCP, primary care provider. And this is your regular routine doctor's visits. It's where you might get your annual blood draw, your common checkups, and where you're keeping track of your ongoing health needs. The next section, the middle section, is urgent care. And this is somewhere in between your routine visits and the emergency department. or the emergency room. Urgent care, and we'll talk about this more on the next slide, but is really designed for more minor illnesses or injuries. Like maybe you've developed a rash and it's really starting to affect you, but you can't, your doctor is scheduled out weeks or maybe months in advance. So you might go into an urgent care. What you can expect when you go to an urgent care is that you would check in at the front desk, you would wait for some time, and then you would be seen by a doctor or maybe a nurse practitioner. Whereas emergency care, this final line over here on the right, should be sought anytime that a condition or something that happened might be life-threatening. And let's go to the next slide and take a look at what those might be. So here on the left, you have the emergency room. When you go to the emergency room, it can be quite expensive, right? You pay more for urgent or emergency services. You would go to an emergency room for something like if you have a severe burn, right? Maybe you're cooking and you accidentally burn, you have a boil injury or something like that. If there's something where you have a child or a newborn, you're going to go to the emergency room. If there's poison, maybe you accidentally, or a child accidentally ingested some cleaning product. So these are all reasons to go to the emergency room. Same thing if you have severe heart concerns, another great reason, or a blunt trauma or impact to the head, go to the emergency room. For most everything else, though, you're going to go to urgent care. And that's going to be for things like we talked about rashes. Maybe you have pink eye, right, where your eye gets kind of bloodshot in there and it gets really, really itchy and you get some crusties on the outside. That happens. That also, is common in children as well. It's very contagious. So that's a great reason to go to urgent care to be seen more quickly. And anything that's a little bit more minor, right? If you have a cold or flu-like symptoms and you can't get to your doctor as soon as you would like, you're going to go to urgent care. That's going to be the better option. So I wanted to share about those 3 different options with you because they're each very different. And most countries operate differently when it comes to medical care and medical provision. So you have your primary care provider that's here for your annual regular checkups, ongoing medical care and provision. You've got this urgent care for things that need to be seen today, but maybe aren't life-threatening. And then you have your emergency room or emergency department for things that are life-threatening. And when in doubt, call 911. Next slide. Here we're going to talk about employment service providers. So we've talked about different kinds of agencies, right? County and state agencies, resettlement agencies, community-based organizations, and ethnic community-based organizations. And now we're talking about what services are provided at some of those. So employment services, you might hear them referred to as an RSS provider, Refugee Support Services. You can find those, and this is going to be really important, especially for Ukrainians who are seeking housing assistance, especially for those seeking the HAU funds, housing assistance for Ukrainians. Your county caseworker can connect you with an employment service provider. The map at supportguide.org, if you scroll on the left side and click on employment services, it'll show you all of those that are providing employment services across the state. You can also go to the RPB, right, the Refugee Programs Bureau website, and find the training providers and the counties listed there. Well, what do they do? How do they help you? So go to the next slide. These providers, their job is to help you find a job. And some of the things that they might ask for from you as you're seeking their services, they might ask for your A number, maybe a copy of your passport or your identity documents. They might ask for proof of your financial resources. But the best thing about these RSS providers and these local organizations is that they provide culturally appropriate services. They also provide services in language. So most likely they're going to have individuals on staff who are paid, who are trained, who have high accountability measures that speak Ukrainian or Russian. And so this is, you see that little medal, that kind of trophy there, because they're going to be the best folks to work with for Ukrainian newcomers. You can also go to local job centers. They're commonly going to be really helpful for degree evaluation, right? They have some resources usually to support degree evaluation, or a community service block grant, family self-sufficiency. It's a lot of words, but these are providers in different counties that can help you find a job as well. But again, those RSS providers are going to be your best bet. Next slide. So when you go to an RSS provider, right? So when you go to somebody an agency whose job is to help you get a job, there's a few things that they're going to be providing you with. One, they're going to do an intake and an assessment with you to make sure that this is the best fit and that they understand what your goals are so they can help you attain those, right? Some of them might be more long-term goals that you might not be able to reach during that program. Some of them might be more short-term. A key component of these providers is that they're wanting to help you get a stabilization job. So a job to help you earn money quickly, so you can start paying rent, so you can start having some more income to support your family, both here and wherever you might be sending money to help your other family. They're going to provide you with job readiness classes or job readiness training. That's normally referred to as JRT for short. They're going to assess your English level, and there's no wrong answer. It's okay if you're not proficient in English. There's even jobs for people who don't speak any English, right? And some people go, well, I don't speak any English, I can't get a job. I bet if you go to one of these RSS providers, they know what to do. And they have relationships with employers in the area who can help you get a job. They're going to provide you job search support. They're going to help you with your resume. Maybe you've never had a resume. Maybe you've been a stay-at-home parent. They can help you make a great resume. Maybe you have extensive professional experience and you have a multi-page CV. They're going to help you get that into the conditions that a US-based employer would want to see, which is one page. They're going to support you with interview prep and resources. What's interesting about questions here in the United States with interview prep is that there's usually a question under the question. So if an interviewer asks you, what are your 3 weaknesses? Well, there's a specific way to answer that question in an interview that's going to be best for you and help you get the job. They can also support you with financially with items required for the job. What does that look like? Well, maybe in a position you might need steel-toed boots, right? So they can help you pay for those. Maybe you might need a specific uniform, right? They can help you pay for that, right? So any of those barriers that you might be experiencing to getting to an interview or getting a job and keeping the job, they can help you with. Next slide.
So we have talked about the different kinds of agencies that you will interact with and the different services that the different agencies are able to provide. And the next section is some helpful reminders or tips as you engage with those agencies. Next slide. First, it's important to remember to have patience with these agencies. We want things and we need things, and we need them many times very urgently, and it's understandable that we need those urgently. But the reality is the caseworker is working with many people and has a large caseload, or the number of people they are working with. And sometimes there is an emergency and not an emergency. So we may have what is felt as an urgent need, but it may not be the emergency compared to the entire caseload. So it's important to remember patience. And second, when we're working with the agencies, remember they have financial limitations. Depending on the program or donations, there are only a finite amount of funding that they can help to either provide or pay staff to help provide. So while they may want to do more, sometimes they just cannot, and it is not the fault of the agency. So have patience there as well. But also remember that there are time limits on benefits. Sometimes they are very specific, whether it's that initial federal resettlement of 90 days, it could be 210 days, depending on some of workforce programs, or 5 years to be able to access programs, depending on other programs. So remember that there are time limits, and as they are asking questions and helping you with those needs, the eligibility many times can affect what you are able to access. And finally, when working with any of the agencies, remember that many times you may work with a volunteer. And volunteers can be very helpful, but also remember that they are not being paid. They are doing this to help you. And so many times they need patience as well. So as you engage with agencies, please have patience with them. And as we move to the next slide, also a tip to remember is to have patience with yourself. This slide is more patterned after the initial resettlement process. But the point of the slide is that moving to mastery from arrival is not a straight line, and it is not always a line moving upwards. It is a process. We talk about the initial, once we're in a new location, everything is new, everything seems good, because it is new. But then we encounter things that are difficult. As Hannah talked earlier, the medical process and the types of places we go could be very different. We may have been able to access care at a pharmacy in our home country. That is not the way it works here in the United States. Those things can cause frustrations. And after enough of those frustrations, we enter into a culture shock. Everything is difficult. We may just want to go home to where things were normal, but then we begin to adjust. And from adjustment, you see another dip. That is because it's a process. So we bring this up to you to, again, have patience with yourself, because the experience of resettlement is not an easy one. And so just remember that you are in this process as you engage with the different agencies.
Go ahead and go to the next slide. This is a lot of information. The next thing that we're going to talk about is the ideal life cycle, right? What is the sequence that's best to work with these different providers, and then resources for where to find these providers. But before we get to that, I'd like to open it up. What questions do you have? Please post them in the Q&A if you navigate to your Zoom controls. There's something that looks like kind of two little questions moving together. And we see one here that says, hello, does the amount of help or benefits that can be received depend on the amount of money that a person brought with them to the United States? That's a great question. And what's important to recognize here is that when you're completing your forms to apply for public benefits, that you complete and you answer them honestly when they ask about your assets, right? So, or how much money that you have with you. So the eligibility for how much money you receive is actually a pretty complex process. And that's why there are staff at the county level whose entire job is to review your application, determine eligibility, and compare that with a pretty complicated matrix to determine what is the amount of financial assistance you should be receiving. And then there's an ongoing kind of renewal process where you have to submit certain documents, they review them, and your benefits might be adjusted depending on, sometimes more, sometimes less, depending on those, let's call them renewal documents. So that can impact the amount of benefits, but that's not the only thing impacting the amount of benefits. Where you live, how many household members you have, if you have any additional medical concerns, and things like that are all going to be elements that are considered when a county eligibility worker determines the status. Great question. So another question here. If a client receives an in-kind donation, like a gift card or a bike as a part of the program, does that count as income for the county? If it's a CalWORKs, right? If they're enrolled in CalWORKs. My understanding is that it does not count as a part of income if it is an in-kind donation. So in-kind means not cash. So if it's a bicycle, maybe they were gifted a couch or some other basic household items, that is not considered income. All right, we'll take one more question here. And the question is a follow-up on that. What if it was a gift from a friend? I'm so glad they have such generous friends. No problem. All right, we're going to keep going, but please continue to ask questions in that Q&A space, and we would be more than happy to share this information. We'll also have more Q&A time at the end of the session. Next slide. So for those who are new here, and maybe you've gone through this process already, or maybe you're on the front end of it, we're going to talk about what is the ideal life cycle, right? What is the sequence that's best to work with these different agencies in? So let's go to the next slide. So first, you receive your status, right? So you receive Ukrainian humanitarian parolee status. That status is associated with the kinds of benefits that you can receive. So because you have that status, you can then go to the county office, and that's where at that county office, and there's going to be one close to you. Remember, you can also apply online. And at that county office, they're going to be able to assist you in receiving cash assistance, money for food, medical insurance, and a referral, right? They're going to send you to a specific location with a specific agency, or let you pick from a series of agencies to receive employment services. And earlier we talked about what those employment services are or could look like. And then you engage with those services. You might be put on a wait list. There could be a little bit of time that it might take to fully enroll and get started with that program, but that's normal. And remember, their job is literally to assist you in learning about what's available in your community and how to access it. Let's go to the next slide. So what are the other services that you might be enrolled in at that kind of final step there? Employment services, we've talked about that. And English as a second language services. You might be referred to a health department, or maybe what's called a refugee health clinic. Some people refer to that as an RHC for short, Refugee Health Clinic. They're going to provide you with a general medical screening, maybe some vaccinations, right? Then you're going to enroll your children in school, kindergarten to 12th grade. You're going to get connected with transportation, so learn how to ride public transport, how to read the bus maps and what they mean, what you can anticipate if they're behind or ahead of schedule, and also receive cultural education. Every culture, every location, every place has unique elements about it. And sometimes they're very obvious, and sometimes they're kind of unstated. And so those norms and that etiquette, and you're going to learn about all of those components. I want to mention the sequence here again. Employment services first, right? Help get your feet on the ground, start earning funds, start earning money, enroll at the same time, usually in ESL classes, get to that health department, then get your kids enrolled in school. We're going to talk about school next. So let's go ahead and go to the next slide. Adult education. And remember, all of June, all of our sessions in June are dedicated to these next 3 slides. So more to come. Adult education, community colleges, upskilling, getting certificates and licenses and things like that. Community colleges are a great place to do that. There are community colleges who offer ESL, as well as libraries and things like that do. But adult education, wonderful. Please see what's available in your community. And then universities. Universities are a little different. There's both public universities and private universities here in California. Something to be mindful of is, what are your goals? If you're already maybe mid-career and you want to return to university because your maybe degree isn't recognized here, just recognize that that is going to be a significant financial investment, and really think through, what are the priorities for you? Is it attaining more education, or is it maybe earning more money? And are there other ways to get there? Maybe there are, maybe there aren't, but that's what enrollment counselors in your job employment services providers can help you address. Next slide.
So when we talk about primary education, education for children, it can be very confusing because there are several different kinds that are possible within California. And it's important to understand the difference. As Hannah said, part of June, we will be focusing more in depth on education, but today we'll give a high-level introduction to the different types. There are first the traditional public schools. These are schools that are based in a school district, and the district is near where you would live, which would tell you where you would send your child to a traditional public school. These are run by the state through state departments and then to the local district. That is different than a public charter school. A charter school comes in association with a traditional public school and has a charter under a school district to have accountability, but also can innovate and operate a little differently for some specific offerings and options. Then there are magnet public schools, and these are specific to individuals and may have a specific theme, such as math or science, and are typically you must apply and be accepted into magnet schools. And so it is a different type of public funding or public education. Then there's online learning. Also, many public schools have online and educational options that teach students about digital options. And so there are, through public schools or charter schools, there are online options. All of the ones I've mentioned so far are free and part of California education. There are then private schools that you may have heard about. Private schools are widely available, but they charge tuition. So they are not part of the state provided education and can have options that a parent may choose, but a parent would also have to pay for those. And then there is home education, also known as homeschool. In California, every parent has the freedom to homeschool their children and provide education themselves to their children. However, a parent must provide annual notification to the state or their local school district of their intent to homeschool. The state also requires some accountability to homeschooling parents and requires them to teach certain subjects. However, it does not require the same standardized tests. So there is some accountability. It varies. You may have to purchase your own curriculum to teach those subjects. The point of understanding these is knowing that there are many types of options that go from the traditional public school all the way to homeschool, and each one is a little different, which we will go into in upcoming sessions.
Go to the next slide.
So one of the things that we want you to know is that many school districts and most of the districts that are impacted from Ukrainian arrivals, and by that would see a lot, what I mean is there are a lot of Ukrainian arrivals in the area, have a family engagement department. And that is a department that is specifically for supporting families that are newcomers and other families as well. Also in public schools, there are school counselors. And of course, there are teachers. And then there are administrative staff. What's important to understand is within the schools, there are many different roles, and engaging the proper role is important. Knowing what the job is of the different people within the school is important for you as a parent to understand how best to engage with the school. then there are many after-school activities that are offered with sports. They can be academic related. Sometimes they require payment to pay for the activities. Sometimes they do not. So there are a lot of options and a lot of different roles within those traditional public schools. And it is important to learn and ask. Next slide.
Legal services can be confusing. I know we had our last session on re-parole and heard from our colleagues at USCIS and Office of Refugee Resettlement. What I want to point out here is that there are free or sometimes free and often low-cost legal services in the state. They are listed on the map at supportguide.org and also on Refugee Programs Bureau website. They'll be included as a link in the information that we send after the session as well. So just wanted to highlight it's available, but do expect that there are some quite long wait times to be seen by a legal practitioner. Next slide. I know we're jumping across lots of different kinds of topics, but so it goes when you're learning life here in the United States, lots of different things. This map essentially shows that there are a diversity of banks across the United States. There is no federal bank. There is no specific state bank. I want to show you that map on the right so you can be familiar with what are called bank-on, banks that support the bank-on standards. Essentially, that is something that this bank or agency has agreed to make their services more accessible to refugees and immigrants, have lower fees if you forget to make a payment or something like that. That will also be available. And with that, next slide, loans can be very difficult to get as a newcomer without a credit score. And your credit score dramatically impacts what your financial mobility. So I want to point out, we've had a prior session, feel free to look at that online, about loans for newcomers. You can go to IRC's Center for Economic Opportunity to learn more about that. We're going to go ahead and slide on down to slide 40, Charlie, if you can. We're coming up near the end of time here. And I want you to know that there are a lot of resources available. So you can go to supportguide.org. Go ahead and go up one slide. You can visit Nova Ukraine's refugee portal, also with some really wonderful information on there. And go down to 41 now. What's most important to remember are these next two things: that select the right agency for what you need, right? And you need to ask, what are their expectations of you, right? What do they think that you're going to do? And make sure that you understand what your rights and responsibilities are. I'm putting that in air quotes, not because it's something loose and uncertain, but because most programs should be able to provide you with a document that lists, these are your rights and your responsibilities. And should you have an issue, here's how you can escalate it, right? So really ask. The best way to have a good relationship and get what you need is to have clear understanding. It might not be what you want to hear, but at least you know now. Next slide. Finally, again, ask, talk about it, make sure you understand, have patience, right? As you're aligning those expectations. The best thing that you can do if you have a caseworker or somebody that's helping you navigate these systems is to communicate, really help understand what's expected of you and what they need. Also remember business hours, right? Staff work 9 to 5. If it's an emergency, call 911. Otherwise, they will get to your phone call as soon as they can. And it's okay to ask people, hey, I think you might have made a mistake here, but be ready to demonstrate why. This document says that a UHP can enroll. Well, here's my status. Can you help me understand what's different? Right? Talk to another agency. Have someone help you advocate for you. Finally, as we're heading the top of the hour here, on the next slide, I want you to know that this slide deck in English, Ukrainian, and Russian will be available online after today's session, as well as the links that we have discussed or put in today's chat. Go ahead and go to the final slide. Please fill out this survey. You'll see a QR code here that you can lift your phone up to and take a screenshot of it. Next slide, Charlie. And that's also where you can ask additional questions. Please, if you put a question in the survey, add your email. Otherwise, it's anonymous and we don't know who to contact. We want to get you the information. We want to help you. And we're so glad that you attended today's session. Our next session is coming up in May about employment services, getting jobs, getting better jobs, how to work with your resume, how to talk to employers. All of that will be in the next session. And then June will be focused on education. In the meantime, have a great week. Thank you for joining us. And you'll get an email with all these resources, a link to all these resources sometime this week. Take care. Have a great day.